Strategies for special needs school nurses to improve coping in social isolation due to the pandemic. My name is Janice. This project was implemented along with Dr. Cherry Carl. School nurses support the provision of quality health. Special needs school nurses often work quietly and behind the scenes. Many people do not realize the enormous scope of their duties. Special needs school nurses are responsible for providing nursing services for children with complex healthcare needs while protecting the health of the community. The purpose of this project is to decrease some of the effects of professional isolation by offering special needs school nurses several online modules that provide strategies to improve self-coping skills. The school nurse role has changed dramatically since the pandemic. One of the most critical roles is working with special needs students and connecting with other school nurses. Both of these roles have changed. Some nurses have been left to deal with the school and have less contact with each other. Monthly meetings has provided a form of professional connection, which has now diminished. Special needs students were in and out of school due to challenges with COVID testing. My PICO question: will school nurses who were presented with several online modules designed to improve self-coping with professional isolation score higher after the modules than before? The outcome: school nurses will score higher on a coping survey following online modules designed to improve self-coping. Nurses are familiar with crisis, suffering, fear, pain, and even death. The emotional, physical, and mental trauma that nurses and frontline caregivers endured during the pandemic were enormous. In March 2020, the coronavirus crept in and became an invisible killer, driving thousands of sick people to the already incapacitated hospitals. In New York City, there was no preparation for this pandemic. A vast majority of people were dying daily. There were inadequate number of ventilators. The fear and sadness were constant. Nurses and doctors were burdened by the emotional struggle between the professional duty to their patients and the personal fear for themselves. The coronavirus has affected the 2021 school year and has thrust special needs school nurses into the spotlight, and some school nurses are overwhelmed. Studies have detailed the physical and psychological impact on primary health care professionals, such as special need nurses. There are rising mental health concerns and feeling of isolation. Amid the pandemic, the fear of isolation and psychological stress for special need nurses were emotionally taxing. Nurses were assigned to nursing homes where the level of the coronavirus was the highest. They were transferred to different schools called rec centers, where children of first responders attended. The staff and principals were unfamiliar, therefore increasing isolation. My proposed intervention. Prior to my EBP implementation, I would request permission from my nursing supervisor and school administrator to reduce barriers to our EBP project. After receiving permission, I will build an interprofessional team of 6 special need nurses within the district. I will clearly explain my EBI project and offer a pre-test survey using a 5-point Limpert scale. Several online modules will be designed to help decrease professional isolation. After the intervention, Nurses will score higher on the post-test. The strategies for wellness when school nurses are professionally isolated. Connect with colleagues. Check in with one colleague a week. Try to avoid too much emphasis on the bad news. Share good news with others. Connect with others in the workplace if able. Dissemination of the EBI. I plan to disseminate the EBI by having an interprofessional conference call and by email. After the service test, I will provide modules on coping to my colleagues every 4 weeks. I will discuss the effectiveness of the project with my mentor after receiving the results of the post-test. According to the review of the literature, school nurses are an integral though often misunderstood population within the healthcare and educational profession. A school nurse can influence a student's school performance, absenteeism, and overall quality of life. However, school nurses work in isolation daily. Coping with isolation will increase. Perceived stresses will decrease. Special needs school nurses will be satisfied and have a great sense of well-being. Tips for managing your stress. Acknowledge and understand your reactions. Appreciate that you will have reactions such as stress, anxiety, and grief to the increased and ongoing stresses you are encountering. Be aware and monitor your well-being. Activate your parasympathetic nervous system to combat stress. Take time for your mental health. Thank you very much for listening.